Hello, and welcome back to Med-Surg Knowledge Nuggets, where we take big nursing topics and break them down into manageable, test-friendly content. Today we're talking about encephalitis. Encephalitis is a serious inflammation of the brain. Unlike meningitis, which affects the protective layers around the brain and spinal cord, encephalitis actually involves the brain tissue itself, and that includes the cerebrum, brainstem, and cerebellum. Sometimes, when both the brain and spinal cord are inflamed, we call it encephalomyelitis. So, how does this happen? A pathogen, usually a virus, travels into the central nervous system and starts invading brain tissue. It multiplies there and causes inflammation in the cerebral cortex and white matter, which can really mess with how the brain functions. Every year, thousands of encephalitis cases pop up, mostly caused by viruses like herpes simplex types 1 and 2 and arboviruses. These are viruses transmitted by insects like mosquitoes and ticks. So, for example, herpes simplex virus type 1 is a big player here, causing about 2 million cases in the US alone, mostly in young adults between ages 20 and 40. The virus spreads through saliva or nasal secretions, while type 2 spreads sexually. Encephalitis can show up sporadically or in outbreaks. Other viruses you should know about are West Nile, St. Louis encephalitis, and rabies. Plus, it's not just viruses. Bacteria, fungi, and parasites can also cause encephalitis, but it's less common. An important point, some cases of encephalitis are actually autoimmune, meaning our own body's immune system attacks the brain, often triggered by cancer or other autoimmune diseases like lupus. Let's talk about the clinical manifestations of encephalitis. Since this is an infection that causes inflammation in the brain and spinal cord, you'll see both infection-like symptoms and neurological changes. Your patient might start off complaining of a headache or feeling really sensitive to light and sound, which is also called photophobia and phonophobia. A stiff neck or nuchal rigidity is another red flag that points to the central nervous system involvement. As things progress, you'll want to keep a very close eye on their mental status. Are they more tired than usual, confused, disoriented? These could all be signs of increased intracranial pressure, and that's when you will need to do something. You might also notice things like muscle spasms or tingling sensations. Those are focal neurological signs that tell us the brain is being affected. Diagnosing encephalitis, we treat it a lot like meningitis. You will anticipate lab work and a lumbar puncture to check the cerebrospinal fluid, CSF, and imaging such as an MRI or CT scan to see if we can get a clear picture of what's going on. Sometimes an EEG may be done also if there are concerns about seizures. Moving on to assessment and nursing interventions. As nurses, your assessment skills are critical. You're going to look for changes in neural function because swelling in the brain can quickly raise intracranial pressure and affect consciousness. You want to monitor those vital signs. Fever and a fast heart rate are common, and increased ICP can push blood pressure up with a widened pulse pressure. Look for signs of meningeal irritation like positive Brzezinski or Kernig signs. Also, assess cranial nerves 3, 4, and 6. You might see the patient's eyes deviated downward and outward with a dilated fixed pupil on the affected side. Don't forget to monitor fluid balance since fever and medications can cause fluid loss or also nausea and vomiting. Lab tests like your CBC, your complete blood count, and liver function are also important because antiviral medications can affect the bone marrow and the liver. For interventions, you want to keep the head of the bed elevated about 30 to 45 degrees to help with brain drainage and reduce pressure. You want the patient to be on seizure precautions because this inflammation lowers the seizure threshold. Encourage oral fluids as tolerated, dim the lights, keep the environment quiet to help with photophobia and phonophobia. Turn and reposition your patient every 2 hours to prevent pressure injury, and consider stool softeners to avoid constipation, which can raise ICP if patients strain with defecation. Teaching. Finally, teaching your patient and their family is key. Explain the risks of immobility like skin breakdown, blood clots, and stress how important it is to keep up with their rehab and follow-up visits with their provider. Recovery from encephalitis can be slow, even weeks to months, so patience and compliance are crucial. These patients will often be critically ill, requiring admission to an intensive care setting or ICU. Remind the patients to finish their full course of antivirals or antibiotics to prevent the infection from coming back. Final knowledge nugget for encephalitis. So encephalitis is brain inflammation with an infectious twist. So you're going to think fever, headache, and neuro changes like confusion and muscle spasms. Always assess LOC and watch for signs of increased ICP. Diagnosing it mirrors meningitis, so lumbar puncture, labs, and imaging are your best friends. As a nurse, your job is to catch those subtle neural changes early and to advocate for prompt treatment to protect brain function. Thanks for watching. If this helped clarify things for you, make sure to like, comment, and subscribe for more Med-Surg knowledge nuggets just like this one. See you in the next video.